Good morning. I'm Dr. Stephanie Keller. You just heard from me a second ago. I just want to say, to follow up on Dr. Rubin, that paper that she was discussing that has the list of what's a leukodystrophy and what's a leukoencephalopathy, that one is online for free. There's a series of papers that were published at that time. There's another one about care suggestions for your pediatrician, how to diagnose a leukodystrophy. All those were made free and open, that you can Google those and you can look at them and you can provide them to your primary care physician. So just know that those are out there for you. And also about the adult leukodystrophies. It is hard to find adult care providers for leukodystrophies. There's a lot of overlap with some other white matter diseases called multiple sclerosis that you've probably heard of. So sometimes some of my patients have ended up going to a multiple sclerosis provider. So if you're looking for a neurologist for an adult with a leukodystrophy, I would probably try those providers and see if you can get in there. Multiple sclerosis, it's a white matter disease that's actually autoimmune, so it's not really a leukodystrophy, but there are some shared symptoms, and so those providers sometimes will follow adult patients with leukodystrophies. So, and also bigger academic centers are the ones where you're more likely to find like an adult provider. So I know not everybody lives near a big academic center. Sorry? You went there? Mayo, yeah. So some of the big centers, you'll be more likely to find a provider there. So let me go ahead and read my little statement here, okay? So welcome to the ULF Family Conference, and the title of my session this morning is Forming Your Medical Team. We hope you are enjoying the conference so far and hope that you will continue to support the ULF's mission to provide support to the leukodystrophy community and enable platforms to accelerate improving patient quality of life and finding cures. We are here this year to collaborate until cured. Thank you for joining us in person and virtually. Before we begin, a quick note on our recording policy. This session is being streamed to the public via Zoom, and it is also being recorded. It will be posted on YouTube for the entire world to see. So everyone in the room with us and everyone joining us at home, we ask that you please keep in mind that what is shared during the session is public. If you have any concerns regarding your privacy, we ask that you take measures to protect yourself at your level of comfortability. If you do not wish to be in the recording, please sit out of the line of the camera or turn off your video. If you do not want to vocalize your questions, please enter them into the chat box, bring them to the room moderator to be passed on to the speakers, or plan on asking the speakers outside of the sessions. Thank you for understanding that these educational sessions are extremely important to the entire community, and our goal is to share the information in its entirety so that everyone can benefit from it. We would also like to remind everyone to speak respectfully to each other. We want this to be a pleasant and educational experience for all. So again, my name is Dr. Stephanie Keller. I'm a pediatric neurologist in Atlanta, Georgia, at the Children's Healthcare of Atlanta. I think it says Children's Hospital of Atlanta, but we are Children's Healthcare of Atlanta, and Emory University. I run the leukodystrophy clinic there. So today we're going to be talking about forming your medical team. We know that with leukodystrophies, we think of the brain primarily, and as a neurologist, I'm a little biased. I think we kind of own the leukodystrophies a little bit more, but there's actually a lot of symptoms that can go along with leukodystrophies, so there may be a lot of other providers that you would want in your child's care. And I'm sorry for patients that are adult patients. I'll try to aim a little bit to you guys, but of course I'm pediatric, so I'm sorry, it's always going to be biased that way for me. So your medical team. So the ones we're going to talk about today, again, not everybody may need all of these providers, and it's going to vary based on the person and also the stage of the disease. Some of these providers you may just need to see annually or just for screening visits, so they're not something that somebody that you have to see regularly. And unfortunately, not all services are going to be available everywhere. So some of these providers I talk about you might not have in your area. And not all services or not all providers may be exactly familiar with your disease. These are rare diseases, and so there are going to be a lot of doctors that haven't heard of these diseases as well. It doesn't mean that they still can't be helpful to you or your child. There is, like Dr. Rubin was saying, there is a lot of overlap with leukodystrophies and other diseases that we treat. So your doctor may need some guidance about what's maybe particular to your leukodystrophy, but they probably have experience in treating some of the symptoms similar to that. And specialists are experts in your leukodystrophy, like some of the people that are talking here today that are maybe experts on vanishing white matter disease or X-linked adrenal leukodystrophy. It can be great to go and see them, but I know they don't live next to all of you. So sometimes, like some of my patients, they will go see like Dr. Vandiver. They may see her once a year, but then they come and see me that I'm closer to them and I can do more of their routine care and they can see me more often. It's really hard to manage a patient out of state or at a distance because we do have some limitations on our license about being able to prescribe out of state. And also if your child's in a hospital out of state from us, we don't maybe have access to all those records and we don't know the people caring for them. So it's really hard to kind of manage every day from a distance. Okay, sorry. Okay. So yeah, you might just need like a neurologist who's going to be your care provider locally to you, and then you can have some specialists more at a distance that they can communicate and provide your regular care. Sorry, I'm not a good multitasker. Okay. So we'll start out with who should probably be the lead of your team, and that's your primary care doctor. And that's probably the first person that you started with in your journey with leukodystrophies. So your primary care doctor is going to be your team leader. So they're going to help coordinate all of your specialists, and they're really the one that all of your records should go back to your primary care doctor. They'll help make sure that you're seeing all these specialists, that you're getting in with the people that you need. There are sometimes, primary care doctors can be very intimidated by a child with a complex disease. And so certainly as specialists, we're willing to help them. And I'll give you guys some information that you can pass on to your primary care doctors later in the talk. But you definitely want to continue to follow up with your primary care. And I always say kids with leukodystrophies, they're still kids. They're still going to have all the needs that other kids do for their pediatricians. So vaccinations, regular ear infections, viruses, all those things. They're still going to need their pediatrician for all of those things. Pediatricians can also help us monitor for complications or determine when a child needs to see a specialist. There may be things like problems with feeding or weight gain, constipation, problems with mood or irritability or concentration, problems with sleep or pain. Your pediatrician may certainly be able to handle these things and manage them for you, or they can help us with saying, this stuff's getting out of hand, we really need help from a specialist, and they can help refer you for that. An additional person that, again, may not be available to everybody would be a complex care pediatrician. This is kind of a newer field of medicine, and we see it more often at kind of the bigger centers. So in recent history, we've had improvement in the diagnosis and care of children with complex diseases, and so they're living longer, we're finding their diseases more often, so there's been this explosion in the numbers of kids living with chronic conditions. And the proportion of children with a chronic condition that interferes with daily activities has increased by greater than 400% since the 1960s. And so they have a definition of children with medical complexity as children with chronic conditions associated with medical fragility, substantial functional limitations, increased health and other service needs, and increased healthcare costs. So this complex care pediatrician was born, and it's a new specialty that's kind of evolving. And so what they do is they help to coordinate the care of children that are seeing multiple specialists because they have these chronic diseases. And they can really help with the coordinating plans of care. At our institution, the complex care pediatricians, they put together this really nice form for all of the patients that kind of has an overview of all the specialties they're seeing and kind of what the plan is from each specialty. They can also help communication between specialists because sometimes there can be problems that may overlap multiple specialists, and the complex care pediatrician can be a good voice to say, hey guys, we've got this problem that affects both of you, how are we going to attack this? And they can also make sure that there's adherence to the recommendations of care and follow-up that are being followed by the recommendations from the specialist. So they can look and see, hey, your orthopedist wanted to see you back in a year, and you guys get busy taking care of your kids, and you forget that you saw the orthopedist a year ago. They can kind of be on top of that and make sure you've got follow-up appointments for those things. Or say one of your doctors recommended some testing, they can say, hey, we were supposed to get a test, in 6 months, and they can make sure that that's done. So they're really nice. They can really be a team leader and stay on top of those things for you, so you don't feel like you have to be the one kind of managing everything alone with your child. They have found that complex care pediatricians can help improve health outcomes and lower overall costs. It does not take the place of your regular pediatrician. Sometimes they will do some of the things that your pediatricians do. They may help with treating infections and things like that, but they're really sort of an adjunct to your pediatrician, because unfortunately pediatricians are super busy. You know, they're seeing like 20 patients in a day, and if your child has lots of needs, they may just not have the time to be able to invest and help with all of those things. So this is sort of an adjunct to that. Again, they're not available everywhere, and where they're at, they may only be available in the hospital, helping to coordinate there if your child's admitted. And they also follow a smaller number of patients because they have to take so much time and they're so in depth with their patients. So they may not be, even where we are at our institution, they're not able to follow all of our kids with complex care. They have to limit, you know, the number that they're able to follow. So hopefully this is something that will expand in time. But I just tell you, if you hear about, you know, oh, there's somebody seeing the complex care pediatrician at CHOP, why don't I have one? Unfortunately, they're just not available everywhere. And then neurology, so this is me. So this is a place that you may have gotten your diagnosis for a leukodystrophy, or you're undergoing evaluation for a leukodystrophy is with your neurologist. And so for some people, neurology is sort of your home for care. I do some of the complex care coordination that we talked about for the complex care pediatricians. I also do a little bit of the palliative care, and I'm also kind of making sure that they're seeing all of their specialists that you're supposed to be. So again, sometimes neurology becomes a little bit of your medical home too. So again, they may be the person that gave you your diagnosis. They may be the person evaluating your MRIs or determining what testing is needed. They may also be the person that's explaining the disease to you and hopefully providing some education about what specialists you may need to see and kind of making those referrals or how often you're supposed to get some screening testing. But as neurology, we also can help out with tone and spasticity management, so that stiffness that your kids can get. We have medicines for that and treatments for that. Seizures is also something that the neurologist will manage. Sleep issues we often address as well, and those can be very common with kids with leukodystrophies. Problems with mood or irritability we can also help address with medications or referrals for therapies. And then we also can be a good resource for making sure that your kids are getting the therapies that they need, you know, making sure you've got the appropriate referrals to all of them. And then also for equipment needs or bracing, we can address those things too. Then there's also additional like school recommendations, you know, kind of making sure you're getting all of that assistance that you need at school. For adults, you know, job accommodations or disability, your neurologist can help kind of fill out those paperwork and make sure you're getting those things. And then also we're kind of monitoring, like I said, with your pediatrician for any complication of your specific disease, helping to answer questions about disease progression or if you're having new symptoms, kind of what to do for those. Genetics is another place that overlaps with neurology. Some of us in neurology do more genetics than others, and so this is another place that you may have gotten your diagnosis for leukodystrophy or undergone evaluation there. So again, they may have gone over with you about your disease, and they're also a good place that can help identify who else is maybe at risk for the disease in the family and do additional testing that way. They can also give you information about kind of what are your chances of having another child with something similar, and also for other people in the family, kind of what is their risk. But they can also say, hey, you have this leukodystrophy, these are these specialists that you need to be seeing, and they can help make those referrals. Additionally, same thing, like additional testing that needs to be done and monitored for. Genetics can help kind of lead the way with that information and kind of making sure those things are done. They can also help evaluate for, are there disease-specific therapies that might be available that you would be eligible for. Forgot to say that neurology does that as well. They usually are not the ones that are continuing long-term care, because there's a lot of things that are outside of the genetics realm that are going to be with other specialists. So you may see a genetics person more often in the early parts of the disease. When you go to see genetics, you may see the genetics doctor, but you may also see somebody called a genetic counselor. And we have some genetic counselors talking today. They can give you a better idea of what their job is. But basically, they're not a doctor, but they're a healthcare professional who has specialized education and training in the field of medical genetics. And so they can help you with kind of understanding the testing that's going to be done, kind of what are the limitations of it, or what are the risks of it. They can help determine the risk of the disease for other family members and for that patient as well. They can help with actually arranging the testing to have it done. And then importantly, they can also help interpret those results when they come back, because genetic testing can certainly be very complicated, even for physicians. So they help us interpret it and also help us explain it to you guys better too. Another specialist that may be helpful to you and is present in a lot of places, but not everywhere. Certainly at bigger institutions, you'll have these physicians. They're called physiatrists, or you'll hear it also called rehab or rehabilitation medicine. And they are specialists in the care of children with disabilities for a lot of different reasons. So leukodystrophies, but also kids who have like spinal cord injuries or brain injuries. So they have a really cool job that their job is just really help you get the best therapies and to do the best that you can. So again, they make recommendations for therapies, not just physical therapy and the typical ones, but they can say, hey, maybe you be good for this like robotics therapy or different things that are available sometimes at different centers. They can also make recommendations for equipment that may be helpful or bracing that may be helpful. They also do a lot with tone and spasticity management. So again, that stiffness. They do a lot of procedures like Botox injections that you've probably heard of that helps kind of loosen those tight muscles. That's why ladies get their wrinkles, everything tightens up. And so we use that same medicine to help loosen those muscles that are tight. Phenol injections are an alcohol that also helps loosen tight muscles. We do have sometimes limitations about how much Botox can be used. And so phenol is another option that they have that typically only the physiatrists do, at least in my area. Other physicians like neurology and orthopedics don't do. They may do Botox injections, but they typically don't do phenol injections. Backlift and pumps are also another way that they help us with spasticity management. It's an inserted device that gives a medicine all the time that helps kind of loosen muscles. And that's something that a lot of times physiatrists will manage. And then also there are, of course, oral medications that we use for spasticity that they do as well. Also movement disorders, they help with treatment of that also. And then, again, they can make recommendations for orthotics and referrals there. Orthotics are your braces that they have. But then they also help just with the other complications that can occur with kids with disabilities, like mood problems, concentration, sleep issues, and secretions. All of those things physiatry can help manage too. So you can start to see that there is some overlap between different specialties. So again, if you don't have one of these specialists available, one of your other specialists may be able to take over and help with those things too. Pulmonology is another one that a lot of kids benefit from. So pulmonology is the lung doctors, basically. So they can help a lot with secretion management. So that's the drooling that can occur. Sometimes as diseases get worse, sometimes the kids don't swallow as well. And that can also affect their breathing. It can kind of get in their airway, can cause aspiration pneumonias. So dealing with those secretions can help out a lot sometimes. Also, sometimes the kids can develop sleep apnea. So that's when they have problems like blockage of that airway or just the brain not telling the body to breathe as well during sleep. And so pulmonary can help diagnose and manage that. Also, hypoventilation can develop in leukodystrophies. That's where they're not taking those big, deep breaths or maybe not remembering to breathe as often. And there are treatments for that as well. But pulmonology can also help a lot with preventing breathing problems. And so sometimes, even if the kids don't have significant respiratory illnesses, I like to get them involved early, especially if we're going into winter months where the kids may be more likely to have some respiratory illnesses that could put them more at risk for problems with their breathing. So they can recommend things like nebulizer treatments or vest physiotherapy. That's where you can put on those vests and they kind of shake them and help kind of loosen up all those secretions and the gunk and mucus that gets down in the lungs that maybe the kids kids have a harder time kind of coughing up. And there's also something called cough assist, which again kind of helps get those secretions out of the lungs. So all these things that if we can get you with a pulmonologist and they can kind of get you started on a good regimen, then they can help keep those lungs healthy and clear. So if they do get into an illness, that they're not maybe going to get as sick as they normally would. And then again, the treatments like CPAP and BiPAP, oxygen and tracheostomies, these are all things that the pulmonologist can help determine when it's a good time for these things and how they would be helpful. Gastroenterology is another big specialist that a lot of kids with leukodystrophies will need and who see. The GI tract is full of nerves, so there's a lot of communication between the brain and the gut. And so GI symptoms are common in a lot of leukodystrophies. Those symptoms can include problems with weight and nutrition, feeding problems that they may need, like thickened feeds, G-tube feeding or J-tube feeds. Problems with constipation are very common, reflux, vomiting, bowel mobility. Sometimes the bowels just slow down so things don't move through as well. And then there may be disease-specific problems with the GI tract, like with metachromatic leukodystrophy. They can sometimes have gallbladder disease. With some of the diseases like Zellweger, mitochondrial disease, and Aicardi-Gutierrez, they can have liver problems. With that, they usually see a subspecialist of GI called a hepatologist, so they're a liver specialist. And then an orthopedic surgeon is also another specialist that a lot of kids see and would need. These are the bone and joint doctors. And it's not always about surgery, but they can help with spasticity and tone management. Again, some of them will do those Botox injections also. They can help with recommendation for braces, like the orthotics for the legs, or they can help with maybe back braces that some of the kids get for scoliosis. And then they can do surgery also if it's needed for sometimes if with some of the spasticity, if that's there for a while, sometimes things can get kind of twisted in different positions, or sometimes they can have problems with their hips, and so may need surgery in that situation, and that's where your orthopedic surgeon can help determine when that would be helpful. But orthopedic surgeons, I try to get them involved earlier, and especially in kids that are not as mobile, because they can develop things like problems with scoliosis. So if you're not able to hold yourself up and you're sitting a lot of times leaned to the side, then that can start to become a permanent curve, and you can compress the lungs on that side, and that can cause problems with breathing. So it's really important to monitor for scoliosis. The other one would be hip dislocations. A lot of times kids that aren't walking or maybe sitting in a chair a lot, they can have problems with if the increased tone is there, it can kind of pull on those hips, and those bones can kind of come out of place in the hip. So they monitor for that. Not everybody needs surgery for that, but sometimes if it's causing pain, they will recommend surgery. So they're good to have somebody that you can follow with, and then if you do have issues, they're there for you. But again, sometimes in the beginning, this may be somebody that you see like once a year and get some x-rays, and they say, come back and see me next year. I'll touch just a little bit on palliative care. I know Dr. Rubin gave a good kind of summary there. So palliative care, their job is just to maximize the quality of life for people living with chronic disease. I think a lot of people associate it with end of life, but really it is for people with any stage of disease. It's just people with chronic conditions. And again, their aim is just to make your life as good as they can. So they can help with things like pain management, mood or irritability problems. They can help with decision making, like do you want to do these certain surgeries? They can also help with just emotional coping and spiritual support too. Again, their palliative care is a great resource, but it may not be available at every place. Again, the bigger institutions may have them. Sometimes it's limited whether they're available outpatient as well as inpatient. I know at our facility, we're a big children's hospital in the Southeast, but unfortunately we only have palliative care in the hospital. Hopefully that will improve in the next couple of years. But again, they're a great resource, but they can sometimes be limited. And I just have a little chart here that just kind of shows the difference between palliative care and hospice care. There are certainly some overlaps. The things they have in common, again, they're wanting to optimize comfort, reduce stress, relieve symptoms, and provide emotional and spiritual support. But again, what we talked about with palliative care, they're again for any stage of disease. And you can continue to pursue curative treatment at that time. So you can still be going through, stem cell transplant or whatever may be helpful for your child. Hospice care, the typical is that it's supposed to be a prognosis of 6 months or less. It's not always exactly have to be there for the pediatric patients. I have some kids that have been on hospice care for years even. They typically, though, their aim is for kids more at the end of life, and at that time, you're usually not pursuing, big things like maybe the stem cell transplant. But in pediatric patients, you can still continue to get your vaccinations. You can be treated for colds and illnesses. You can even, go into the hospital if they need to. So there's a little bit more leniency in pediatric hospice care. And this goes wherever you go. So they come out to the house. They also provide services that, if your child has a problem in the middle of the night, you have a nurse or somebody that you can contact. You don't always have to bring your child to the ER. So I know these can be scary things to think about or talk about, but they can really be a really good resource for you. And therapists, which I think are probably more important than us doctors. I may be biased, but I think they're amazing. So there's physical therapists. So they are the ones that work on the big things like rolling over, holding your head up, sitting up, those big kind of motor things, trying to walk or trying to stand. Occupational therapy, they work more on the fine motor things, so doing things with your hands is typically occupational therapy. They also work on things like bathing, toileting. They can also help with sensory issues. So if your child has, some sensitivity to loud noises, and with that they get really upset, or it's certain textures, they can't stand the feel of something, then occupational therapy can be helpful in those situations also. Speech therapy is communication, but sometimes that's not always verbal communication. So we do have lots of different equipment now that can help kids communicate. There's things that look like tablets where they can pick pictures to help them communicate what they want. There's also things now that if your kids can't use their hands to pick those pictures, it can just be with eye gaze. It's really cool. They have these attachments that go to the computer and they track where the kids look, and if they look at that picture, it kind of verbalizes it for them. I've seen some kids do amazing things with those. They can have conversations with me that way. And then there can also be more simple things that are just like buttons or switches that can just be pre-programmed things in there that they can say by indicating this button, or kind of simple yes/no things. I've seen kids even use their head just to activate the button. So there's lots of ways we can help your kids communicate. There's also other things like feeding therapy, which is typically not its own therapy. It's usually either done through occupational therapy or speech therapy, and that can be determined kind of by what the problem is with feeding. Is it more of a mechanical feeding problem? Is it more of a sensory issue, like they don't like certain textures of foods? That'll determine kind of which specialist does your feeding therapy. We also have kind of cool things that I always like to get the kids involved in, like aquatic therapy. Again, that can either be more PT-based or occupational therapy-based. And then we have hippotherapy, which I'm not sure how it got its name hippotherapy, but it's not with hippos, it is actually with horses, which is still very cool, but I don't know why we don't call it horse therapy. But again, that can also be physical therapy or occupational therapy. Again, that's not everywhere. I'm sure in the city of Chicago here, they don't have hippotherapy, but maybe in some of the outer-lying places you might find that. I will say with the aquatic therapy, at least by us, they offer it a lot of times at some of the YMCAs. Music therapy is another one that a lot of kids enjoy. And then you may have things called intensive therapies where they may go for a few weeks and do very intensive therapies, like every day getting some therapies instead of where you go like, once a week or something like that. I have a lot of my kids that'll do these intensive therapy programs sometimes during the summer, and maybe they'll do that like every 3 months or sometimes every 6 months. And a lot of families find that really helpful. The kids can kind of make some big gains during those intensive therapy kind of courses that they do. But your therapist, they can help you with providing some home exercise programs and stretches that you can do. So don't always depend on all of your kids' physical therapy to occur during those therapy sessions. You really want to be talking with your therapist and asking them for ways that you can do things between your therapy visits that could help out. Sometimes it's just playing with them a certain way or doing some stretches while you're watching TV, things like that can help out. Therapists can also make a lot of good recommendations for equipment that could be beneficial for you at home, not just for their mobility, like walkers or things like that, but they can also make recommendations for things like bath chairs or strollers, things like that that help you in everyday life. And then they can also make recommendations for braces, like when the kids might benefit from some AFOs or SMOs, things like that. As the neurologist, I'm seeing the kid for a brief visit, so many months. So it's really nice to have those therapists that are seeing the kids more often to say, nope, now's the time we need the braces. And then they can also help with goals to obtain new skills that maybe initially the thing you're thinking of is I want my kid to be able to try to sit up or try to maintain or try to get head control. And I think those are always good goals. But also the point of physical therapy or some of these other therapies is to maintain the skills that they have. And also the range of motion that they have. So sometimes families get discouraged when they're not seeing great gains with the therapies. And everybody's going to be very individual. So if you see that somebody else's kid is doing all these amazing things in therapies and you're getting very disappointed that your child's not making those gains, try to be patient with your child, that they're going to go at their own pace, and try not to always compare them with other ones. I know that's really hard. But a lot of what therapy is maintaining the abilities that the kids have and the range of motion that they have, because that tightness that develops, that can start to mean that maybe they can't move their arms and stretch them out as good as they could, or maybe you can't move their hips and change their diapers as well, or they can't move those ankles as well. It's more difficult to dress them. So there are a lot of benefits to therapy other than just trying to get new skills. And then some of the other people that I think are wonderful are social workers and case managers. Again, those are probably going to be at bigger children's hospitals. Probably if you have like a private practice neurologist or physician, they're probably not going to have a social worker or a case manager that works with them. But these people can be very helpful with like financial assistance programs or insurance questions, like getting insurance. There's a lot of grant programs out there for different things, like different things that insurance may not pay for. So sometimes if you need like a special needs van, something, or a wheelchair accessible van, insurance is usually not going to cover those things. Or sometimes bathroom renovations or other renovations to your home to help accommodate a wheelchair. There may be programs out there that you could apply for to help you pay for those things. And a social worker is somebody who may know about those resources and can help you with that. Also, if you're having problems with things that you can't get with insurance, like sometimes I know in our area the insurance doesn't always like to cover bath chairs, which I think is silly, but there may be other programs that they could help connect you to that may have those things. Like a lot of times there's equipment exchange programs. There's some local to us. I know some other organizations have equipment exchange programs. So that's where, like, if your child has grown out of some equipment but it's still in pretty good shape, you can donate it there, and then other families that maybe they're having a hard time getting that approved by insurance or they can't afford it, then they can get those things. And sometimes it's free or maybe just like a small fee that you pay. So those are great programs. We do that a lot for special needs strollers, because the kids may have the good wheelchair that's got all the support, but it's really super heavy and hard to get in and out of your car. So a lot of kids also like to have a special needs stroller that's more collapsible, that maybe you can take for just quick trips, that you can get in and out of the car more easily. But a lot of times insurance doesn't want to pay for both of those things. So sometimes you can have insurance pay for the big heavy wheelchair that's more expensive, and then sometimes you can use some of these equipment exchange programs to get maybe one of those special needs strollers that you can use. But I really encourage you, if you have some equipment that's sitting around the house that your kids aren't using anymore, try to donate it rather than just kind of letting it sit there collect dust, okay? They can also help you with school resources if you're having any problems getting some support from your school, like if they're not giving your kids the therapies, or if there's some other problems that you're having with school, social work can help out with those. Also, as a child gets older and you have those adult transitions, they can help you with trying to going to a provider, also doing things like getting the guardianship, all of those things, and applying for social security for your kids as they're getting older. Social work can help out with those. And then also just, this is a big diagnosis, and a lot of people need some support, and there are a lot of great support groups out there. The social worker themselves can be support for you, but they can help connect you with maybe other families and organizations like the United Leukodystrophy Foundation that can provide some emotional support and direction. And then there are some disease-specific providers. So these are providers that maybe not every child with a leukodystrophy needs. It's going to be a little individual to kind of what your leukodystrophy is and kind of what other symptoms it can cause. But common ones are like the endocrinologist, which is the hormone doctor. So things like X-linked adrenal leukodystrophy has adrenal disease, and they really need endocrinologists. Some diseases may cause heart problems, and so you may need a cardiologist. Some cause dental problems, and so you might need a good pediatric dentist. Audiology is the hearing testing that's done. Rheumatology, some of them like Cardi Gutierrez have an immune system problem, so following with rheumatology may be helpful. Ophthalmology is a big one that a lot of kids need, so that's the eyes, and again, that may be just kind of yearly check-ins. You really want to see a pediatric ophthalmologist, so there's the optometrist, which is the eye doctor that's like in Walmart, you may go through for glasses. They're great for screening, but for these diseases, it's really good to see an ophthalmologist who's actually a doctor that specializes in diseases of the eye, and you really want to try to see, if you have a child, see a pediatric ophthalmologist. They're going to have better ways to kind of get that eye exam on a restless kid and also be more familiar with the diseases that affect children. And then sometimes you may see an epileptologist if your kid's having significant seizures. So an epileptologist is a neurologist like me, but they have special training in more difficult to control seizures. So depending on the severity of the seizures, if they're pretty easily managed, then just your regular neurologist could do that. But if it gets more difficult, they may refer you to an epileptologist. So some tips for to help your provider. Again, they may not all be totally familiar with your disease, or you may be seeing a new provider. So some things that can be helpful would be keeping certain medical records. So this can, for lab results, genetic test reports are really helpful to keep and be able to show those to a new provider. Also any metabolic labs or some of those enzyme labs that she was talking about earlier. A lot of times those things are not always in the medical records that we share. Some of you may have heard of Epic. It's an electronic medical record that a lot of systems have now, and they have something called Care Everywhere, which is really nice that we can see other records from other places, but a lot of times these type of lab reports are not always in there. So it's good to keep your own copy and be able to share that if you go see a new provider. Imaging reports are, again, another one that's really important for us to be able to see, but we also, as neurologists, really like to see those pictures of the MRI ourselves, so having a disc that has those pictures on there of your MRI can be really helpful, and sometimes that's one of the hardest things to get from other institutions, so if you guys can keep one of those with you, that's always great. And then other things, other reports that we don't necessarily need the actual test on a disc like we do the MRI would be EEG reports, EMG reports, audiology or hearing testing, sleep study reports. If you at least have those that you can bring with us and show, that's important. Office notes and discharge summaries are great. We usually don't need. Sometimes if you just get the record from a hospital stay, it'll give you every vital sign your child had while they were in the hospital, and I promise we don't need all of those. Or all the little day-to-day nursing notes while they were in the hospital, we don't need those things. A good discharge summary is really the only thing you got to keep with you. And again, any test reports. If you can keep with you like a list of all your child's diagnoses that they've had and the different surgeries they've had, just keep it on a sheet. I know a lot of people keep binders. Everybody's going digital now, which is great. So if you can just keep a list of that around, that can be helpful. And you also want to keep a list of your providers and their phone numbers, address, and fax. That way, if somebody does need to get records from another provider, then you can easily access that and give it to them. And then sometimes it can also be helpful to have just a summary of your child's rare disease with you. There's a lot of them on the internet. They probably gave you one when you were diagnosed. The ULF has some summaries on their website as well. That can be helpful. Like if you go to the ER for something and they're not as familiar with rare diseases, you can say, hey, this is my kid's disease, and they can look over that and it can help the provider that you're seeing. And then it's also helpful to have a list of your medications, or sometimes even a picture of the bottles can be helpful because we can quickly see what that dose is, what your tablet size is, and concentration. That could be super helpful. And then these are just some of those care guidelines that Dr. Rubin mentioned. There are some that are just for general leukodystrophy care, and then there are some for type-specific disorders. So X-linked adrenal leukodystrophy has some care guidelines for pre-symptomatic screening with the MRIs and also the testing for adrenal disease. Multiple sulfatase deficiency has some recommended care guidelines. Krabbe also has some recommendations for how children are supposed to be followed with newborn screen and when they're supposed to go to treatment. So this was in that series that Dr. Rubin mentioned that had what is leukodystrophy and what's a leukoencephalopathy. One of their other papers was a consensus statement on preventative and symptomatic care of patients with leukodystrophies, and they did an update in 2017. That's a good one for your pediatrician. And then the other one she mentioned, the practical approaches and knowledge gaps in care for children with leukodystrophies, is also another good one. Both of those you can Google and you can find on the internet. They are available. You don't have to pay for it or go through any certain online engine. And then this is just some of the papers I mentioned for the X-linked adrenal leukodystrophy that has some good guidelines for your doctor that's following you. And then I just wanted to mention also, if you're looking to find a leukodystrophy specialist on the United Leukodystrophy Foundation website, they do have a page if you go under resources, and there's find a physician, and they have some list of physicians that have some experience with leukodystrophies that maybe you can find somebody close to you. And that is all I have for you today. Does anybody have any questions? Yes, sorry. Do you want to talk really loud and I'll say what your question is? Okay. Sure, let's get you we'll get you a microphone.
Testing? Okay, good. My name's Donna, and I have two sons who are adults with Aicardi-Goutieres syndrome. And as they got older, I found that, and when they transferred to adulthood, I thought things would be easier. I could use my local doctors, not go downstate, use my local hospital more. And I actually found out it was the opposite. And I want parents and families to know that, that if you have a very high needs person, specialists who don't see high needs, you know, and just normal people every day in small communities probably will not see your child. We end up now having to go to the university hospital, which is 250 miles away, for everything, including hospitalizations, because our local hospital will not hospitalize my kids. So be prepared that you think it would be easier. It actually gets more difficult. There's also less services. You really appreciate Ronald McDonald when your kids become 18 and you can't use it anymore. It was really great to use that. I want to talk about some other things that you may or may not know that I learned much later about. We now meet weekly with our pediatrician as part of palliative care. This was suggested in leukodystrophy conference about 15 years ago when I was there. And at first I thought, that's a lot to do. And what if I have nothing to say? But I've had something to say every week for 15 years. And sometimes I've had 3 pages full of things for my pediatrician. And it helps keep your kid healthier, safer. You find things sooner, like infections. You keep your doctor up on things. You do a lot of communication with it. And I just know every Wednesday, 11:45, I have to meet the doctor. And it's been very grateful. I suggest other families really look into that. If you don't want to do it every week, set it every other week or something like that. But don't just only wait for when your kid is really sick. Palliative care team, we didn't have one in town, so, but this is a way you can do something like palliative care if you do not have access to a team in your town. And even if you do, I still would recommend seeing your pediatrician on a scheduled basis. I want to tell you about my sons. They developed severe aspiration, and we were going to try hospice, and instead we were told about something called a Lindemann tracheal separation. It's a very rare surgery in terms of nobody knows about it, but they do what's like a laryngectomy for people who have larynx cancer, but instead they just do a partial one where they cut the trachea, turn it to the throat, and this is your airway down here, and it stops all aspiration. Your kids will never aspirate again. They can start eating food again. It was a big step for us, but it's something I want parents to know about when you get to that point where you're having such respiratory issues, and it will happen. And I want you to know about that. It's called a Lindemann tracheal separation. Lindeman. And it's something available. And then their only airway would be right here in their throat. Both of my sons have had that, a few years apart, and I'm grateful for it. Another thing you need to know, as your kid gets more difficult, I never knew this until a few years ago, you can have ambulance transport to appointments, or if you're going to the hospital for surgery, you can have ambulance transport instead of taking your kid yourself if your kid is getting to the point where it's difficult to transport them. I've been grateful for that, especially because all of our doctors are 4 hours away. And it was getting too difficult for me to drive down in one day, see 3 doctors, and come back. And when someone told me about that, I was stunned. But yes, it's available. So be aware of that. If your kid reaches the point they're in a wheelchair or need more respiratory issues, or they can't handle a long ride sitting up, you can get ambulance transport paid for by insurance. A couple of other things I suggest is open up a document right now and keep a summary of everything that happens to your kid, like hospitalizations, ER visits, new doctors, events that happen, because you think you're going to remember them and you don't, and they start muddling in your mind. And so I have a summary that I opened up about 15 years ago, and just if there's an ER appointment, an ER doctor or a new doctor or something like that, or an event that happens, just open it up, find the spot, just type in quickly, we started this therapy on this day, or we started this new med on this day, or we were in ER on this day. And it really helps to have that record, because you can hand it to your new doctors, and it helps. It just helps. And the last thing I want to talk about is some of our kids will not talk, they're nonverbal. And some have dystonia or things like that and cannot move. Our son had dystonia, and one was blind, so he couldn't use eye gaze. The other had dystonia, couldn't use the eye gaze devices. So we went over 20 years never having communications with our sons. Until someone talked about Pod Talk. It's called PODD. It stands for something, but they found a way for our kid to indicate yes or no, but we learned a pattern of questions to ask them that they could anticipate and be able to say something, because one of them, if he turns his head left, we know he's saying, I have something to say. And then you ask these questions in this order, and he'll say no, 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 yes. And it's amazing, because I didn't think my sons understood anything, and they do understand everything going on. Even though that son is blind, he knows people, he knows places, he understands things greatly. He even jokes sometimes by saying, I have something to say, and you go through every single question, and he answers no, and then you say, are you joking? And he goes, yes, really big. And it's just amazing, the things that I want you to be aware of, that as we are going along, my son's oldest one is 31 years old. We didn't have a lot of things back 20, 30 years ago. that, like, my sons are considered blind. They had no visual impairment teachers. They just said they can't do anything. My sons were told we had no speech therapy because they said they can't do anything, but they can if you get the right person and know the right things. I love talking to my kids now. I am grateful that they've lived long enough that we could learn to communicate with them. And that's all. Thank you.
Yes, thank you. That was great information. We'll have you come up and do the talk next year. Any other questions from anybody? Any other comments you want to share? Anything helpful that you found with your child or family member? Somebody's got something to share. No.
There's something in the
There's
chat.
something in the
but I
chat. I'm
don't-
sorry. Let's see. Should palliative care be covered by insurance? Is the primary care doctor the only one to provide this care? So palliative care can be covered by insurance. Certainly everything depends on your insurance, what they cover, but certainly for a lot of people it is covered. Is your primary care the only one that can provide palliative care? No, a lot of them feel comfortable with it, but as a neurologist, again, at my institution, we don't have outpatient palliative care, so I end up doing a lot of palliative care with my patients. And feel pretty comfortable with that. Also, the physiatry doctors, they do a lot of palliative care as well. So you will find some other specialists that are comfortable with that, the complex care pediatricians that I mentioned. Again, it's just hard though as some of the other specialties to have as much time to devote to palliative care as a dedicated palliative care doctor. Like Dr. Rubin was talking about, sometimes it can be a long wait to get into a neurologist. So you can imagine having a weekly visit or every 2-week visit with a neurologist is really hard to get in to do that. But we're certainly available to help with all of those needs to try to make your child comfortable. So yes, if you don't have a palliative care near you, there's people that will certainly help out with those things. Anything else? All right. Well, thank you guys for sticking it out today. You did it. You made it through my talk. So we'll take our next talk will be in just a little bit.